Welcome to another practice question video. At the end of the video, sign up for free daily practice questions and free bonus nursing printables. Now let's begin. Starting with question 1. In a client with diarrhea, which outcome indicates that fluid resuscitation is successful? A. The client passes formed stools at regular intervals. B. The client reports a decrease in stool frequency and liquidity. C. The client exhibits firm skin turgor. D. The client no longer experiences perianal burning. The correct answer is the client exhibits firm skin turgor. A client with diarrhea has a nursing diagnosis of deficient fluid volume related to excessive fluid loss in the stool. Expected outcomes include firm skin turgor, moist mucous membranes, and urine output of at least 30 milliliters per hour. Evaluate dehydration by observing skin turgor over the sternum and inspecting for longitudinal furrows of the tongue. Next question. To avoid fecal impaction, psyllium, Metamucil, should be administered with at least how many ounces of fluid? A. 4. B. 6. C. 8. D. 10. The correct answer is 8. Bulk-forming laxatives must be given with at least 8 ounces of liquid plus additional liquid each day to prevent intestinal obstruction. Bulk-forming laxatives retain fluid in the stool and increase stool weight and consistency. Psyllium, dietary fiber, carboxymethylcellulose, and methylcellulose are common examples. It is important to take ample amounts of water for bulk-forming agents to work. Lack of water, in turn, leads to bloating and can cause bowel obstruction. Next question. The nurse would teach patients that antacids are effective in the treatment of hyperacidity because they A. Neutralize gastric acid. B. Decrease stomach motility. C. Decrease gastric pH. D. Decrease duodenal pH. The correct answer is neutralize gastric acid. Antacids work by neutralizing gastric acid, which would cause an increase in pH. Currently, antacid use is restricted to the relief of mild intermittent gastroesophageal reflux disease, GERD, associated with heartburn. The estimated prevalence of heartburn at least once per week in North America ranges from 18% to 28%, with 25% of adults reporting heartburn daily. Next question. The following are common causes of dysfunctional labor. Which of these can a nurse, on her own, manage? A. Pelvic bone contraction. B. Full bladder. C. Extension rather than flexion of the head. D. Cervical rigidity. The correct answer is a full bladder. A full bladder can impede the descent of the fetal head. The nurse can readily manage this problem by doing a simple catheterization of the mother. Next question. The following are interventions to make the fundus contract postpartally, except A. Make the baby suck the breast regularly. B. Apply ice cap on fundus. C. Massage the fundus vigorously for 15 minutes until contracted. D. Give oxytocin as ordered. The correct answer is massage the fundus vigorously for 15 minutes until contracted. Massaging the fundus of the uterus should not be vigorous and should only be done until the uterus feels firm and contracted. If the massage is vigorous and prolonged, the uterus will relax due to overstimulation. Next question. The nursing intervention to relieve pain in breast engorgement while the mother continues to breastfeed is A. Apply cold compress on the engorged breast. B. Apply warm compress on the engorged breast. C. Massage the breast. D. Apply analgesic ointment. The correct answer is apply warm compress on the engorged breast. Warm compress is applied if the purpose is to relieve pain but ensure lactation to continue. If the purpose is to relieve pain as well as suppress lactation, the compress applied is cold. Next question. When attending a client with a head and neck trauma following a vehicular accident, the nurse's initial action is to A. Provide oxygen therapy. B. Initiate intravenous access. C. Immobilize the cervical area. D. Do oral and nasal suctioning. The correct answer is immobilize the cervical area. Clients with suspected or possible cervical spine injury must have their neck immobilized until formal assessment occurs. Maintain cervical spine spinal immobilization and minimize neck movement, particularly during transport. Beware that absence of neurologic findings does not eliminate the possibility of spinal cord injury. Next question. A patient who is on chemotherapy has a history of cardiac disease. The client is at risk for cardiac complications because A. White blood cells are reduced. B. Oxygen carrying capacity may be reduced. C. Sodium levels may rise, meaning fluid overload. D. Hematocrit is lowered. The correct answer is oxygen carrying capacity may be reduced. If hemoglobin and red cell counts drop from myelosuppression, the oxygen carrying capacity will fall, leaving the person at risk for angina. Some chemotherapy agents cause the heart muscle to weaken soon after chemotherapy begins. Novel angiogenesis inhibitors that suppress new blood vessel formation cause blood pressure to rise dramatically and may increase the risk of blood clots and heart failure. Next question. A client who is taking mycophenolate mofetil must follow which of the following instructions? A. Take with food. B. Avoid use of corticosteroid. C. Monitor for adverse effects. D. Practice effective contraception. The correct answer is practice effective contraception. Effective contraception is essential because of the potential for teratogenic effects. The client must use acceptable birth control during her treatment and for 6 weeks after she stops taking mycophenolate. The doctor will tell her which forms of birth control are acceptable for her to use. Mycophenolate may decrease the effectiveness of oral contraceptives, birth control pills, so it is especially important to use a second form of birth control along with this type of contraceptive. Last question. Which of the following groups of clients are most at risk for GI bleeding from the use of NSAIDs? A. Clients with dysmenorrhea. B. Clients with headaches. C. Clients with arthritis. D. Clients with renal failure. The correct answer is clients with arthritis. Clients with arthritis are taking the drugs for prolonged periods of time and may take higher doses. Nonsteroidal anti-inflammatory drugs, NSAIDs, are a drug class FDA approved for use as antipyretic, anti-inflammatory, and analgesic agents. These effects make NSAIDs useful for the treatment of muscle pain, dysmenorrhea, arthritic conditions, pyrexia, gout, migraines, and used as opioid-sparing agents in certain acute trauma cases. Choices A and B are incorrect because the use of NSAIDs with these clients is intermittent. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.